Hey everyone! Today we're going to talk about Down syndrome, also known as trisomy 21. So, what is Down syndrome? Well, everyone is born with 46 chromosomes, 23 from your mom and 23 from your dad. In trisomy 21, though, you are born with 47 chromosomes. That means you have an extra 21st chromosome, hence the name trisomy 21. Well, how can this happen? It all happens in a cool process called meiosis. Meiosis is basically how your chromosomes divide. There are 15 phases, and the phase that affects Down syndrome is anaphase 2. Normally, after the chromatids line up at the midline of the cell, also known as the metaphase, they divide and go to opposite sides. The dividing cell is called disjunction. In trisomy 21, the incidence of non-disjunction happens. This means one of the chromosomes did not divide. So now there is an extra chromatid in the cell, and this is Down syndrome.
Bill Nye the Science Guy. Bill Nye the Science Guy. Bill Nye the Science Guy.
Science rules.
Bill Nye the Science Guy.
Inertia is a property of matter.
Bill Nye the Science Guy.
T minus 7 seconds.
Bill Nye the Science Guy.
Our client's name is Lloyd. Lloyd is a 21-year-old male who has moderate hearing loss, a congenital heart anomaly, which is a heart defect, maxillary hypoplasia, which is lack of gums, microglossia, which is a large tongue, and myopia, which is nearsighted. Lloyd has recently been placed into a group home. It has been reported that Lloyd tries to communicate, but group staff and residents are not able to understand it. We are here to help Lloyd.
Hey, I'm Crazy Crania, and I'm here to talk to you about the craniofacial structure of Down syndrome. First of all, here is an example of a person without Down syndrome. And here is an example of someone with Down syndrome. I'm about to explain these differences and inform you about how they affect function. I'll start off with listing some of these physical differences, which include differences in the sutures of the skull, a small stature, upward slanting eyes, a more flattened nose, an irregularly shaped mouth, which Bill Nye will explain to you next, and smaller ears, which Dr. Reisner will tell you about later. Sutures, what are they? Sutures are what join the plates of the skull together. In a normal developing child, the plates of the skull should fuse completely together over time. 1, 2, 3, 4, 5, 6, 7, 8. In Lloyd, the fusion of these plates does not occur properly. This causes his head to appear flatter in the back. There is an obvious difference in the nose of those with Down syndrome. Someone with Down syndrome has a more flattened nose than that of someone without Down syndrome. This flattening of the nose causes something called cul-de-sac resonance, which Lloyd has, that causes his voice to sound muffled and not understandable to those around him. In normal resonance, air escapes from both the nose and the mouth during speech. In cul-de-sac resonance, like Lloyd, air does not escape from the nose during speech. All of the sound resonance gets trapped in the nasal cavity and only escapes through the mouth. Cul-de-sac resonance is usually caused by a blockage in the nose or throat. This blockage makes it difficult for the sound resonance to escape through the nasal passageways, and also might make it difficult for Lloyd to breathe through his nose. This may also be caused by a blockage in the sinuses due to the smaller flattened nose and smaller nasal passageways. Treatment of cul-de-sac resonance involves medical intervention, which could include just the use of decongestants or antihistamines, or it could possibly, in more severe cases, have to be treated with a surgical procedure to open up the nasal passageway. Back to you, Bill Nye.
All right, now we're going to take a look at the oral structure. Now here, if you look, this is an example of a normal-looking oral cavity. Now, the teeth should be properly occluded, which means that there's no overbite or underbite, and that they fit together just right. Also, there should be a nice symmetrical look to the roof of the mouth, also known as the hard palate. And the tongue should have enough room within the oral cavity to sit nice and comfortably, but also have the freedom to move. Now, we're going to take a look at Lloyd. Now, Lloyd's oral cavity and structure has been affected by his Down syndrome. This can change a lot of things in structure and how everything is put together, and that can cause a lot of problems. Let's take a look. Now, when we look at Lloyd and someone with his oral structure, someone with Down syndrome, some of the things we're probably typically going to notice is that the bones of the midface and the maxilla, which are right here, are a lot of times a lot smaller and underdeveloped. And what that can lead to is what we call a class 3 malocclusion, which basically means that the mandible is further up and the lower teeth are in front of the upper teeth. This leads to an open bite. Now, an open bite leads to a lot of problems like mouth breathing that can affect oral hygiene and oral health. A particular problem with Lloyd is also that he has macroglossia, which means that he has an enlarged tongue. You can see here that that enlarged tongue can protrude through that open bite, and this is going to cause a lot of articulation problems, meaning that when he's trying to speak and make sounds that use the tongue, like the d and the t and the th sound, he's probably going to have some problems. Now, when we look at the palate, it may appear that the arch, the very top of the roof of the mouth, is higher than usual. But this actually is a problem of the sides of the palatal arches. The unusual cranial structure often causes the sides of the hard palate to be abnormally thick. And this thickness makes the space inside the mouth much smaller than normal. And when your mouth is too small, your tongue gets cramped up and doesn't have the right amount of space needed to pronounce speech sounds that use the tongue.
Hi, I'm Tina, the muscle toner, and I'm going to talk to you about Lloyd's hypotonia. Fast, normal muscle, fast. Hypotonia muscle. Weak movements. In Down syndrome, the weak muscle tone makes it hard to accurately produce speech sounds, specifically labial consonants like P in pump, as well as rounded vowels such as oo, as in blue. In general, hypotonia affects lip and tongue movements. The other muscles that insert into the orbicularis oris help make different facial functions, such as smiling. Now, Lloyd's orbicularis oris and the muscles inserted into the orbicularis oris are weak, so it is hard for him to properly articulate his phonemes. Here are some exercises that he can try to strengthen these muscles.
Okay.
These exercises target the orbicularis oris muscles, the muscles around the lips. First, pucker your lips as in a kiss. Hold and then relax. Repeat several times. Next one, open your mouth and try to pucker with your mouth wide open. Don't close your jaw, hold, relax, and repeat several times. Next, hold a piece of paper between the lips and try to keep me from pulling them out. Next exercise, take a Cheerio M&M and hold it in between your lips like you would a whistle and pucker. This will help strengthen Lloyd's lip and cheek muscles. Pucker your cheeks like you were a fish. Hold and repeat several times. Now we're going to focus on the jaw muscles. The platysma, big muscle under here, and the masseter, this muscle right in here. The platysma muscle helps draw open the mandible. The mandible is your bottom jaw here. It helps draw it open. The masseter muscle helps to bring it, draw it, helps to close it, so it draws it back up to close. Here are some jaw exercises to help strengthen Lloyd's jaw muscles. Take your hand, have someone put their hand underneath your chin and try to open your mouth. Try this 3 to 5 times. Next, start with your mouth closed. Have someone place their hand under your chin, and without moving your head, try to open your mouth. Try this 3 to 5 times as well. These exercises will work both the platysma and the masseter muscles. Now we're going to talk about some tongue muscles that are affected by hypotonia. Your genioglossus, which is the main mover of the tongue and takes up most of the body of the tongue. Your styloglossus, that runs on the lateral sides of your tongue. Your superior longitudinal is an intrinsic muscle as well as an inferior longitudinal. These are both intrinsic muscles. Intrinsic means that they lie underneath a major set of muscles. The inferior longitudinal muscle inserts at the apex or the tip of the tongue and runs along the body of the tongue as well. As I said earlier, the genioglossus makes up most of the tongue body and it's the main mover of the tongue. The styloglossus draws the tongue up and back. The styloglossus draws the tongue back and up. The superior longitudinal and inferior longitudinal help pull the tongue from side to side like this. Remember, these muscles are intrinsic, and intrinsic means underneath another set of muscles. Now here are some tongue exercises to strengthen the muscles of the tongue. Take a M&M or Cheerio and put it on the tongue, on the upper ridge just behind the teeth. Push up with the tongue. You can't tell I'm doing, can you? You're supposed to do it behind the teeth. As I'm holding the M&M, I am pushing up with my tongue behind my teeth. Next, do I need to say what it targets? Okay. When doing these exercises, this targets the genioglossus, which is the main mover of the tongue, and the intrinsic muscles, the superior and inferior longitudinal intrinsic muscles. These muscles in combination allow your tongue to move and move up. Next, move tongue to touch corners of mouth, like this. This targets the superior and inferior longitudinal muscles. These muscles allow your tongue to move from side to side. Next, clear your food from cheek with your tongue like a chipmunk. This targets the genioglossus and the styloglossus. The genioglossus is the main mover of the tongue, and the styloglossus draws the tongue back and up. Finally, balance a Cheerio balance a Cheerio on your tongue and bring it in and out. This targets the posterior genioglossus and the styloglossus. The exercises I just showed you would not be appropriate for a childhood apraxia of speech. Childhood apraxia of speech is not a muscular problem, it is a programming problem. These exercises would also not be appropriate for language, phonemic, or phonological problems, since those have nothing to do with the muscles. These exercises are appropriate for Down syndrome, and you can also use these exercises for a stroke patient. You can use these exercises because they target muscle strength. This concludes the exercises. I hope you've enjoyed this segment with Tina the Muscle Toner. Now off to you, Dr. Reisner.
Yes, I think I have it. I think I've got it. Yes. This is it. I got it. The formula for the hearing system. Hello everybody, I'm Dr. Reisner. I'm here to talk about the hearing system. Today, I will first start off by describing the normal hearing system. Notice that there is an outer ear, the middle ear, and the inner ear. With the outer ear, you have this lovely part, and then the ear canal, which goes in. So whenever you talk, it captures all of the noise. See? Then once it's put into your funnel of an ear, it goes through the tympanic membrane, aka your eardrum. Now, once it goes from there, it goes through the inner ear. Notice, come closer. It goes into your ear, and then you can see that the eardrum is translucent. Behind it, you see all the bones and the cone of light, which is basically the reflection of the otoscope going into your middle ear. All this is full of air. Then, once it goes from there, it travels from the bones into the middle, or the inner ear. This is the stapes, which is part of the middle ear system, and it connects to your cochlea, which is basically where it transfers all of your energy to here, which is your auditory nerve. This sends all the information up to your brain, which means you can hear. Hey, alright, so now that we know the normal hearing system, we're going to talk about Down syndrome hearing system. Now, sometimes, yeah, they hear pretty well, but most of the time, one of the characteristics that comes with Down syndrome is a small ear. So compare this normal ear to small ear. Normal ear, small ear. Got it? Alright, so a normal ear, whenever it funnels everything into there, it's pretty loud, right? Now, just picture that with a smaller ear. Everything in their system is smaller. So this is what you get. Notice it's not as loud. It's harder whenever your ear canal is much more narrow, smaller. That means that not only will this be smaller, but everything past this will be smaller. So a lot of times there are abnormalities in the middle ear. So the bones may be different, they may work differently, which can send some confusing signals to the cochlea and then to the brain, if you know what I mean. So another thing that I would like to point out is because it's so much narrower in here, that means that the earwax glands, it's going to be kind of hard for them to, get the earwax out. So, look at that. Junkie.
There you go.
You're going to have some fluid in there. You're going to have some fluid buildup and some earwax buildup, which will mean that this will sound like, well, everything that you hear will sound like this. Much more quiet. Alright, so now that you understand Down syndrome ears, we're going to talk about Lloyd's specific case. Now, Lloyd, he has hypotonia, which means his muscles are pretty relaxed. It'll make it much harder for his earwax to be able to be moved by the muscles out of his ear. So most likely, Lloyd either has some buildup in his ear canal, or there could also be something wrong in the middle ear with his bones, as I had said earlier. So, just picture this. With this possibly being a little smaller, and then this going over here to a smaller cochlea, it might be harder for the message to send to the brain. So, Lloyd cannot hear. So, as we said, Lloyd has a little bit of trouble hearing, right? See, this is normal hearing, where you hear -10 to 20 decibels. And then this is mild, it's alright, you can hear some. But then once you get to these levels, moderate and severe, it's much harder to hear things clearly. Here's Lloyd right here. So, as for what all he hears, we're not sure. But we know that it sounds muffled, and we know that it's not clear. This will be an example of how unclear things can sound if you don't have proper hearing. Listen.
What do you think, Catherine?
One way that we can help Lloyd is by giving him a hearing aid. This will amplify the sound to where he can hear, not here, but here at a normal rate. Another thing that we can do to help with all that nasty fluid is we can put tubes in his ears, which would go right about in there.
Now you know more about trisomy 21 and how it affects the speech system.
Bill Nye the Science Guy. Bill Nye the Science Guy. Bill Nye the Science Guy.
Science rules.
Bill Nye the Science Guy.
Inertia is a property of matter.